The noise might have stopped, but the echoes remained. The sudden sounds, the anxiety, the hyper-awareness, the emotional numbness, the inability to relax. This did not vanish just because the uniform came off. And now, the coping mechanisms that had been normalized in the trenches were no longer structured or controlled. There was no ration schedule, no medic administering doses, no shared environment where everyone understood the need. There was only the individual, alone with his memories, and the knowledge that substances had once helped him survive. So he reached for them again. But this time, there were no limits. Alcohol was readily available in civilian life. Morphine and other opiates, while controlled, were still accessible in various forms. And without the structure of military life, without oversight, without support, usage could escalate. What had been a tool became a habit. What had been a habit became a dependency. And because society did not recognize the underlying trauma, the focus often shifted to the behavior itself, the drinking, the withdrawal, the instability, the inability to reintegrate. The soldier was no longer seen as someone managing the aftermath of war. He was seen as someone with a problem. And that misunderstanding deepened the isolation. The man who had relied on substances to function in war now found himself relying on them to function in peace. But peace without understanding offered no relief, only escalation, only expectation. Be normal, be stable, be productive, move on. But there was nothing to move on from because the experience had never been processed. This is the bridge between wartime survival and post-war dependency. The substances were never just about escape. They were about adaptation. The body and mind found ways to cope with an impossible environment. But when that environment disappeared, the coping mechanisms remained, without context, without guidance, and without support. And that is how a generation of soldiers carried the war inside them, long after the fighting had stopped, not just in memory, but in habit.